And as you saw, the Treatment Action Campaign marched to the Ehlanzeni Disaster Management Centre in Mpumalanga today on World TB Day. So the Treatment Action Campaign is calling for government, as you heard in that clip, to declare TB a national health emergency. It says this comes at a time when lip service has been paid about the importance of treating and ending TB, yet critical funds and human resources have been diverted from TB and HIV services. Anele Yawa, the General Secretary of the Treatment Action Campaign, joins me now live. Anele, very good evening to you. Thanks indeed for your time. So you say that in terms of the WHO Global Tuberculosis Report for 2020, I understand South Africa ranks as one of the top 20 countries in terms of TB burden numerically. But resources to deal with this are being diverted. That is of concern to you.
Thanks, Criselda, for having us, and greetings to the viewers at home. That is a worrying fact, because even during the budget speech of the Minister of Finance, we saw a huge budget cut from public health funding, about 53 billion, as well as on HIV, TB and malaria conditional grant. We saw an amount of about 5.8 billion being taken and directed to someone. So it is against this reason, as TAC, we are saying we need political commitment and political will, not lip service. It is against this reason, as TAC, we are saying, let us declare TB as a national health emergency. Let's do to TB response what we did to COVID-19 response. Let there be more resources injected for our response to COVID-19, so that we can ensure as the country that we've got more healthcare workers, more community healthcare workers who will be working with the people of our country to respond on this. But it does not end there, as Criselda. We are seeing every day the Minister of Health giving the people of South Africa statistics about COVID-19. We want to see the same thing happening on TB. We see in many government and public institutions, before you enter, you are being screened for COVID-19. We want to see people being screened in clinics. When they get there, they must be screened for TB. We want to see all our clinics having urine lab tests, so that people can be tested for TB and be treated ill.
If we look at the situation that we're in at the moment, Mr. Yawa, what impact has COVID-19 had on this, given what you're explaining in terms of South Africa's own reaction or response to TB?
COVID-19 came with a lot of disruptions. We saw these disruptions in our clinics. During the hard lockdown, especially between April and July, gates of our clinics were locked. And people living with HIV and TB, whenever they went to clinics for services, they were often told to go back home because HIV and TB were not a priority. We saw community healthcare workers who were deployed in clinics for pre and post counseling being taken to communities to conduct outreach, trace people who are contacts of COVID, and also screen people. And we made a call of saying, government, can you integrate services? So that on its own resulted to many people living with tuberculosis defaulting on their treatment, and others being lost on follow-ups. And also in some communities, we saw police brutality that made the people to be scared to go to communities. So it is against that reason we need to double our efforts, both the government, civil society, donor agencies, and everybody. We need to go to our communities. Instead of having these World TB days in boardrooms, we must have them in our communities, street to street, assisting the people who are working on the ground to trace people who have defaulted on TB and link them back to care. Because if you see, even today's event of the World TB Day was in a boardroom far away from the communities, yet TB response needs us to be at the clinic, address problems at the clinic level, be at the community, address problems at the community level. Meaning that we need to educate our communities about preventative measures around TB, People must know what are the symptoms of TB and what they must do when they encounter these symptoms.
Any commitment given by government today in light of the march that you had?
The Deputy President made some commitments. However, we are going to hold the Deputy President based on the commitments that he has made because, as they say in English, that it is easily said than done. So now everything that he said to us, we want to see it being implemented on the ground.
Anele Yawa, the General Secretary of the Treatment Action Campaign, thank you very much for joining us here on SABC News.